injectables on the face, we covered Botox, but of course the other thing is fillers. And fillers, you know, used to be we would do 15 years ago, okay, make the lips a little bit bigger and put a little filler in the folds here.
Right.
That's all we thought about. Well, now, as you probably know, we're doing fillers in this hollow. We're doing fillers here,
Oh
which sort of
my
like raises the brow a
gosh.
little bit. We're doing fillers here. We're doing fillers in the cheeks just to build the cheeks up, you know.
Right.
We're doing, of course, fillers here, you know, fillers in the grooves here. We're doing chin augmentation with fillers, you know, the jawline. And in people such as yourself who maybe have had rhinoplasty or nose job before where the bridge is kind of
Right.
scooped out a little bit, fillers in the nose.
Well, I would
It takes
definitely
5
do the
seconds.
nose filler, but the thing is, my septum is so twisted.
yeah.
We have no
Exactly.
choice.
I think with your breathing issues in the septum, we clearly need a formal rhinoplasty in your case, you know.
I
But sometimes
definitely breathing could be an important issue.
Yeah, it's
I'm considering that
overrated.
it could
Yeah.
be like something I need to worry about.
You're so picky.
I know. I'm just being really difficult that I
But
want
a
to
lot
breathe.
of times, if someone say you want to do your nose, we need to do it. Your septum's off, your breathing's compromised. We all know that. But you have you want to do it, but you have a bunch of events. You're shooting a pilot, whatever.
Right.
You can't do it. Guess what? You put some filler in your nose. 6 months go by, your nose looks great. Then you have a couple weeks to play with. Then we do your surgery. So
I want to ask
fillers can be
something.
used
Is
for
the
that.
filler in the nose reversible? In other words, let's just say that I got used to seeing a skinny, twisted bridge, and now that I had a nice nose, is there something you can put in to get rid of it?
Yeah,
or-
it's a great question
really?
because, you know, most fillers, there isn't. You put a filler in, it's like, well, okay, well, I got to let it absorb over the next several months, you know.
Really?
But Juvederm and Restylane, which are the most common
Right.
fillers, of course, used today, there is an enzyme called whitease, which you inject it into the filler, it goes away. And it literally a matter of hours.
So if a woman gets like over, like kissing a pool drain lips and overdoes it, you can correct that
Yeah.
by...
Absolutely, and that's why we as plastic surgeons and dermatologists and, you know, doctors who do this type of thing love hyaluronic acids, which is Juvederm and Restylane, because there is that enzyme, which oftentimes the public doesn't know about that. You know, in the
Yeah.
past, if you had really big lips from some other kind of filler, you'd have to inject cortisone into it, which the problem with cortisone is it dissolves everything. Not just the filler, but the enzyme I'm talking about, it goes right after the filler, so it's just great.
Oh,
So-
it's like a Roto-Rooter just for filler.
Exactly, very
it's
specific.
It's very specific.
Yeah,
Well,
and that's why Juvederm and Restylane are probably about 90% of the fillers used these days.
But you know what? That's a big relief for people to know, because one of the things that people are afraid to take the step and do something because it's, what if I don't like it? You know, if you feel fairly comfortable with yourself and you get used to looking at, it's risky for people to take a chance. But if you know that it's, it's
Yeah.
not like a bad facelift that's too tight
Yep,
that you can't
yep.
be,
I agree.
there is something to do.
Yeah, and
I
there's
think
always
it's a comfort zone.
Yeah, there's new fillers being developed all the time. It's just great. There's actually a new Botox alternative that was just approved. That's on the market now. And I don't have any experience with it because the problem with the second product coming out
Right.
is that the first one to market, like Botox by Allergan,
Right.
is, like I get the materials on the new product, which I'm going to look into at some point, but I'm already comfortable with Botox.
Right.
So, but there is a new product on the market. That's
And what's the
competitive.
advantage of the new product? What are
That's
they
the thing.
saying is the advantage?
I don't even know what the advantage exactly is yet. I think most doctors are looking at it as a competitive advantage. In fact, that there's not a monopoly anymore.
Ah,
So
I see.
clinically, I haven't done enough research.
So you have
on the
another
new
source.
product.
So it's become another source for a doctor rather than one particular.
Exactly.
Sort of
Yeah,
like
I've heard-
different brands of aspirin.
Yep, exactly. The other thing about noses, as I may have mentioned to you before, there was a great article in one of our journals about different types of noses because, again, it's like we know what's hard and easy. Gene Simmons, very hard, other people, easy. There was a article about green, yellow, and red light noses. And what that means is there are noses that we think are really easy, the patients are really impressed with the result, and those are green light noses. It's all good, everyone. Ashley Simpson, the green light. Easy, piece of cake, anyone can do it. The public's like, oh my God, that's great. Those are great.
Because it was such an improvement no matter what.
Yeah, big bump, easy. Red light noses, we think we're amazing. We walk out of the operating room going, yep, I'm genius.
Yeah.
Unbelievable. Hardest nose ever, it looks great. Patient looks in the mirror and goes, that's it? You kidding me? I don't like it. It's like, are you kidding me? You know what I did to achieve that?
And they
so-
say you didn't do anything, but meanwhile you know that you cut,
it's-
clipped
and
it.
Other doctors would be like, whoa, you did a great job, whereas the patient's like, it's nothing. So it gets back to the sort of the perception of plastic surgery and the results and things like that, and what's hard and what's easy. It's very interesting.